Hi everyone, my name is Daniel Roger. I'm the one of the lecturers on the Operating Department Practice course at LSBU. I'm also the admissions tutor as well. So what I'm going to do very briefly is give a short presentation about who ODPs are, what they do, with a little bit of background about the course, and hopefully anticipate some of the questions that you might have. Once I've finished, I'll open up to any questions that anyone has. And do feel free, if for those listening, if you do enter something into the live chat, I'll be happy to stop and address those questions for you. Okay. So what is an operating department practitioner? Well, we are one of the members of the operating theatre team, which also includes anaesthetists, surgeons, theatre support workers, also occasionally radiographers as well, that often come in for to take x-rays during orthopaedic procedures. And ODP, also nurses as well. So nurses, registered nurses, can work both in the anaesthetic, recovery and scrubbed circulating roles, and also ODPs as well. So we train to work in the three areas of perioperative care. So we can work as anaesthetic practitioners, scrub and circulating practitioners, and recovery practitioners. And I will explain a little bit about what the differences between those different roles. So ODPs are unique in the sense that they are trained to work specifically in the operating theatre environment. So we will spend pretty much close to 95% of our training in the operating theatre. The exception to that will be sometimes where we may have some placements in A&E, in intensive care units, and maybe high dependency units as well. But the vast majority of the 3 years for an ODP student we spent in the operating theatre learning the role on the job. And this differs from nurses. So nurses over their 3 years of training will complete, get generic experience across a whole range of different areas. This can sometimes include the operating theatre, but it's not a mandatory placement for student nurses. And so they can spend sometimes up to about 6 weeks of their training in the operating theatres, but they wouldn't have any competencies or anything to complete during that period. So if a nurse does want to go on to work in the operating theatres, they will have to complete subsequent training afterwards to demonstrate their competence to work in that area. So the first of the three sort of facets of the ODP role we'll go through is the anaesthetic practitioner role. And this is really where ODPs, you'll find the vast majority of ODPs working is they're kind of specialised in the area of anaesthetic assistance. They essentially help and support patients before and after their surgery. So it can be very simply a patient arrives in the anaesthetic room and they would introduce themselves to the patient, make sure they've got the right patient, having the correct surgery on the correct side, etc. They also check the consent form as well, make sure that the patient understands what they're having done, and confirm all the relevant details. They'll then work with the anaesthetist to prepare a wide range of specialist equipment, drugs, and this can include checking the anaesthetic machines both in the anaesthetic room and in the operating theatre itself. Also getting IV access, assisting in the administration of intravenous drugs, and also a whole range of different devices found in the operating theatre as well, such as warming devices, fluid warmers, tourniquets, diatherming, etc. And then a lot of specialist equipment to do with securing the patient's airway as well, and essentially supports the patient's breathing during their anaesthetic. Secondly, there is the scrubbed role. This also includes being the circulating practitioner as well. So this includes preparing instruments and equipment for surgery, and can include microscopes, fibre optic scopes, robotics, as well, lasers, etc. And essentially what you do in this capacity is you're assisting the surgeon during the surgery. And so the goal is to be able to anticipate, after a period of time, anticipate the needs of the patient and the surgeons that you're working with, and be able to respond effectively. And you're also the individual responsible for accounting for all the swabs, instruments, and any other accountable items during the surgery. And this is really important because if this isn't done appropriately and followed sort of national, local guidance, etc., sometimes accountable items can be left inside patients, and that obviously is associated with a lot of negative outcomes from doing that. So it's something we try to avoid doing, and is completely avoidable as well. And lastly is the post-anaesthetic care role. So we work as recovery practitioners, and this is really where we provide one-to-one care for patients after they've had anaesthesia and surgery. And we will monitor the patient. Sometimes the patients still might have an airway device in situ. We might need to wait until they get their airway reflexes back, and that can be removed. But essentially, you're going to attach monitoring onto the patient, do an A to E assessment of them, and once they're suitably awake, you would then check whether they are in pain, and you may have to administer and pain medication. It might be that sometimes a complication of surgery can be that patients often feel sick afterwards, and so you might need to administer some anti-sickness medication as well. Once you've checked the patient's vital signs within normal parameters, that you've addressed their pain and any sickness, you would then do a sort of final assessment, and then you could get that patient can then be discharged back to the ward. And patients can be in that recovery phase for anything from minutes, if they've just had a small, short local procedure, to sometimes to a day or two, if they've had, depending on the type of recovery unit and the type of surgery that they've had. For instance, if they've had cardiac surgery or neurosurgery. So just looking at registration professional development. So operating department practitioner is a protected title, so no one can call themselves an ODP unless legally at least, unless they've completed the appropriate course and are registered with the HCPC. And when you complete a degree in operating department practice at LSBU, you are eligible to join the HCPC register and work and call yourself a operating department practitioner. Now there are a kind of nationwide shortage of operating department practitioners. Essentially, we can't train enough, and there are around 15 to 16,000 ODPs, which is significantly short of the number that are required in the operating theatres. But one benefit of this is that for those that do finish their course and join the register, there are numerous jobs available. All of our students, I think for the last several years at least, we've had 100% employment for those that have wanted employment once they finish the course. It's also good for career progression as well. A lot of our graduates do very well in the NHS and private sector, and see them progressing very well. And in London, there's probably more so in London than elsewhere, a lot of opportunities to develop yourself and training, etc. The other good thing about ODPs and the training that we provide is that we do give you a lot of transferable skills that can be utilised outside of the operating theatre itself as well. And we often find ODPs working in a range of different areas across acute care. We find ODPs working in A&E, intensive care units, sometimes on the wards, different managerial levels in simulation centres, as resuscitation officers. Essentially, as long as any job that nurses are doing, there's often no real reason why an ODP can't also apply for a similar role. So, as I said, so what does it mean to be a professional? Well, a professional is just anyone associated with a speciality or a discipline who is qualified usually completed training, and is permitted by a regulatory body to provide particular healthcare services to patients. In this case, the Health and Care Professions Council. And this differs slightly, so nurses and midwives are registered by the Nursing and Midwifery Council, the NMC, and medical doctors are registered with the GMC, the General Medical Council. And I think the HCPC responsible for the regulatory body for about 15 different allied health professions. So it's also important to remember that any practitioners who fail to meet the standards of their profession can be removed from the register. And again, that's the similar process involved for nurses and medical doctors. So how the course works at LSBU is training is split between lectures, tutorials and skills training, which can take place on campus and also in the vast majority of it in the practice placement, where students are learning in the theatre environment, working with dedicated mentors. And students can expect, on average over the 3 years, to complete at least 900 hours in practice per year of their 3-year course. So in the first year, it's about 850 hours and then 900 hours for the subsequent second and third years. Now, there is a lot more hours than this allocated. So if you weren't off sick or had time off, you get over 1,000 hours of experience each year. So it is, along with nursing, one of the more intense courses because you are spending the vast majority of your time in practice placement. A general split over the 3 years on average is about 60% of your time in the course is spent in clinical practice and 40% at university. The vast majority of this is completed in the first year, and so that by the time you get to the third year, you're spending about 70% of your time in clinical placement and just the 30% at university. LSR students, we're very proud, have access to a number of not just the country's leading hospitals, some of the world's leading hospitals as well. So we place students at Great Ormond Street Hospital, one of the world's leading paediatric hospitals. Also, Guy's and St Thomas's, UCLH. We've got the Royal London, which is Europe's largest trauma hospital. So a lot of our students have access to national and world-leading hospitals, which can be both an interesting but also challenging placement area for you to be placed in. So a lot of our students will see things and have access to things that a lot of other students outside of LSBU would not have the opportunity to see and participate in. Another thing as well, so our students are routinely employed by the hospitals where they've had their placement practice. It's not uncommon for a lot of our students when they've graduated to not be required to have an interview and simply be offered employment once they've completed the course. So some of the specialist areas of training that you'd participate in over the 3 years would be, in the surgical context, would be general surgery, orthopedics, cardiothoracics, maxillofacial surgery, pediatrics, and obstetrics. So these are all mandatory placements. In the anaesthetic context, obviously you'll be working areas of training, becoming a proficient general, local, regional anaesthesia, trauma areas, ambulatory care, dual life and shared airway. And in recovery, all of the areas above and far more, you'll be caring for patients for a vast range of different specialities. So there are different pathways that we offer at LSBU becoming a registered operating department practitioner. We have the standard entry degree, so this is someone who has achieved 112 UCAS points, is successful at interview, and then they will complete the 3-year degree. Secondly, we have the degree apprenticeship. Now, this is essentially the same course, but you access it a different way. This is where someone is already employed, usually working in operating theatres in a hospital, but not necessarily, and they apply internally at a trust who funds an ODP apprenticeship, and they would be paid usually a band 4 over the 3 years to complete their degree apprenticeship. And as I said, the same course as a standard entry, but you're just accessing it via a different route. You cannot apply usually directly for an apprenticeship at LSBU. It's only accessible to those who are already working in a hospital that is partnered with us to deliver the degree apprenticeship. And then thirdly, there is the extended degree course. And this is where a student, for a variety of reasons, may not have meet the entry criteria for the course of the 112 UCAS points. And so this is a way for students who don't meet the entry criteria to access the course. And this essentially turns the 3-year course into a 4-year course. So you would complete a 1-year foundation year, and this is a year that would be completed with other student healthcare students across a range of different healthcare backgrounds. And upon successful completion of that foundation year, you would then begin in the first year of the operating department practice degree. And so it simply adds another year onto the course, but you get the same degree at the end, and there's no difference to the qualifications. Sorry, I've just seen that there's a question there from Laura. It says, how can one gain experience in the department before the degree? Now, this can be quite a challenge because historically, a lot of people who became ODPs were already working in the hospital, but actually, more recently, certainly over the last 10 years, that's certainly not been the case. And so it can be quite difficult to access an operating theatre department before you start the degree. Now, some students will, one way you can do it is by working as a healthcare assistant in the operating theatres. And so that's primarily the way you're going to get experience. Now, there's nothing stopping you contacting your local operating department, hospital, and seeing if you're able to get a morning sort of work experience or something like that. But that'll really depend on the department themselves. So it is worth trying to contact and see if they're open to doing that. Just say, look, you're interested in applying for the operating department practice course. You haven't had any previous experience in an operating theatre to date, but you were wondering if you would be able to get some time, work experience time doing that. I think that's probably your best life. Theatres is quite a difficult place to get into, and that's just the very nature of the operating theatre environment itself. It's secluded. It's kind of a high risk area, so it can be quite a challenge to access it. But most theatre staff are very friendly, and I'm sure they'd be very happy to support you, especially if there's a trust. Perhaps, I don't know if you're London based, it might be that you want to contact the local hospital. There might be somewhere that if you were successful on the course, you might want to get placed at as well. But that's certainly, and if you're unable to access that for any reason, you're more than welcome to email me, and I can see if I'm able to support you in doing that. So working as an ODP, we are part of a multidisciplinary team, as I said at the beginning, working with lots of different healthcare professionals. And we do, I think it's pretty obvious that we work with patients when they are at their most vulnerable for a variety of reasons. And it is a very rewarding job. You do, at the end of every day, often after every patient, you feel like you're doing something good, and you feel like you're doing something good because you are doing something good. And as I said, yes, it's a very rewarding job. And we also get to work across the whole range of ages. So I worked primarily for several years in paediatrics. So I worked at a paediatric hospital in London, and we provided care for patients from neonates. So often a patient could be just weigh, 500-600 grams, all the way to up to 18-year-olds that were much bigger than me. And that comes with a lot of unique challenges, because you're not those patients have different age needs as well, age-specific needs as well, but you're also having to manage with the anxiety and concerns and worries of their parents and carers as well, trying to address their anxiety so they go away, perhaps less anxious, less worried than they otherwise would have. And yeah, one thing, as I've already noted, so there are lots of vacancies across the London hospitals. There's certainly no shortage of jobs for ODPs. We find that a lot of our graduate students will have several offers and really have the pick of where to go. The average salary in London, I believe, is £32,000. Obviously, it's higher than the average outside of London, because you get a London waiting allowance as well. So if you do have any questions, obviously I'm going to go back to the live chat in a minute, but my email is there. My name, as I said, is Daniel Roger. I'm one of the lecturers on the course and the admissions tutor as well. So if you do have any questions specifically aimed at admissions or accessing experience and things like that, do drop me an email. I'll be very happy to help you with your inquiry. I also recommend looking on the LSBU website as well, just to check that you meet the entry criteria. And there's lots of information about the course as well. So if you do have any further questions, I'm going to be. I think that's the end of the talk aspect of this. But I'll be happy to answer any further questions you have. Okay, thank you very much.